Good morning, everyone. Yate, she Peter Deswood III, and she Tkachin Shleno Kilachini Bashichin Ashina Chedo Toy Haglini Lashanada. I'm recording this video from Farmington, New Mexico, a border town on the New Mexico side of the Navajo Reservation. I just want to give everyone an update on the numbers. I didn't do a video yesterday. Was busy. I also run a tax business, so I was doing some taxes in the evening, and during the day I was trying to get all my staff aligned so then we can provide quality instruction for our students at my high school. So I went to the Johns Hopkins University website again 2 days ago. On March 23rd, the total confirmed cases was 378,287, and the total deaths was 16,497. So this morning at 6:38 on March 25th, the total confirmed deaths was at 436,195. Okay, and on the total deaths is 19,648. Again, these numbers are increasing dramatically. And I know we keep saying that, but I think that's why these messages are important. I know this video is just, I had some people criticizing me the other day saying, why are you doing these? Well, I had some of my listeners reach out to me and say, can you make videos about this? People aren't really taking things serious, okay? So that's part of the reason why I went to do this. I also saw a friend of mine, John Riggs, actor, model, do a video near Shiprock yesterday. You know, it's going to take people, that social media influencers, to get out there and talk with people. And I actually use the data. I have a background in accounting and business and education as well, and we have to cite our sources. And my wife always tells me, cite your sources. So the information that I provide you is usually cited. I usually use the Johns Hopkins University website. So that information, you know, I look at that. I'm a data person. I look at numbers a lot. And in education, they talk about making data-driven decisions. So that's kind of how I use the data whenever I look at stuff. So to more of a local level, looking at the cases, again, this is just from the Johns Hopkins. McKinley County is still at 3 cases confirmed, no deaths. And San Juan County actually increased up to 7, no deaths there as well. Okay, and going across to where a lot of my relatives live in the Lugachiga, Tsaili, Round Rock communities, it is at 4 confirmed cases, 4 active. Okay, so keep that in mind. And then going over to Navajo County, it shows 32 confirmed. And then if you go a little bit further west, you see there are 18, and it looks like in that area, or in Coconino County, there's 1 confirmed death. And also north of Farmington area, or San Juan County area, this is La Plata County. They did confirm 1 death, or not 1 death, they confirmed 1 positive test. That was actually, I read an article, I guess they tested it March 4th. Now I believe there's a lag in when the confirmations do come back, so they printed this La Plata County article, I believe, on Monday. I'll see if I can find the article. I'll post it on there as well. So there's definitely a lag time whenever you look at these, once you're tested. So just remember, people, whenever we look at a lot of this, you know, I did look at the number, the percentages as far as the death rate whenever it's the common flu versus the coronavirus. I did put that on the previous video, and you can take a look at that as well. I'll also cite it here again as well. Another thing, remember social distancing. My wife and I, we are going on, yesterday was 11 days, today's 12 days that we've been in our house. In the 12 days, we've only driven to Smith's to have food put in our car. We went to Target once last week to get toilet paper, and on Monday, I did go to my school to let any staff or students into my high school to get any remaining stuff for the 2 weeks remaining. Although since then, in the previous video I did mention this as well, the governor of New Mexico did put a stay-at-home order in place, so we are actually waiting from the New Mexico Public Education Department to see if we are going to go till April 10th. I know, I think schools, they say they're going to be back in school on April 6th, but there's going to be some adjustments with that. So remember, social distancing. I went on a run this morning. I always run Monday, actually 6-7 days a week. I just do 2 miles. But when I was out, like, I saw 4 people out, and I was running on one side of the street, and I saw a couple of young gentlemen get on the other side of the street when they were running. So definitely practicing the social distancing even out when we're running. Now, stay at home, according to the governor, she said we can still take walks as long as it's less than 5 people. Okay, previous to that was 10, so less than 5 people whenever you're out cruising around. Okay, remember, I did remember what the 5 things are. They say do these 5 things. Number 1 is wash your hands, regularly with soap and water. Cover a cough or sneeze. I know my wife keeps reminding me of this one. Like, she goes, cough into your jacket, cough into the crux of your arm. So cough or sneeze, cover it into in tissue or sleeve. Don't touch, avoid touching eyes, nose, and mouth, especially with unwashed hands. I usually go like this if I need to rub my eye. And then obviously the last one is keeping your distance, avoid close contact with people who are sick. We actually have just been avoiding contact with as many people as we can. Now, keep in mind, this is definitely something hard. I had my sister come by last Sunday with my niece, and I'm pretty close with my sister, and she came by and she walked in the house, and I had to say, "What are you doing? What are you doing?" I was like, this is serious. Got to take this serious. And I think my mom as well. My mom was going around visiting family, and we had to tell her to make sure you stay home. This is something serious. And I think with the actions that Governor Lujan Grisham and President Jonathan Nez on the Navajo Nation. So natives, we have to take, a lot of times we take into account what our tribal leaders say and our leaders in like the state and the local government. Okay, so for people that are not native, if you hear this, we do listen to what our leaders from our chapters. I believe there's 110 chapters on the Navajo Nation, and we have little chapter houses and we have leaders in those areas that oversee and go to Windrock and take our issues up there. But again, like I was saying, Jonathan Nez did say that as well, was that, with the police and their bullhorns going around, that just kind of elevated and put in place how important this is to social distance and to stay at home. Okay, so just keep that in mind as we move forward. When we are trying to take this into account. Again, Jonathan Nez's message is stay home, stay safe, save lives, and that's important. I mean, part of the reason why we're doing this is to flatten that curve. And when you listen to the news, a lot of people are talking about, by flattening that, if that curve jumps too high, we're gonna overwhelm the healthcare workers, the first responders. And by the way, shout out to the first responders. I still see police and firemen around the community, taking care of us and making sure that we are safe and secure. And but remember, flatten that curve. That's why all these actions are put into place. I know there's a lot of people out there criticizing on social media, but someone had commented that this is really drastic. Well, they're trying to prevent. Leaders are trying to prevent it from getting like California, Washington, and New York. And they're saying in the United States that's the epicenter is New York City and New York, the state of New York. But even New Orleans, Louisiana, it's blowing up over there. Okay, it's very interesting because my wife had a conference down there that we were supposed to go to, and it has jumped absolutely exponentially. And so remember, we were 2 days away from going to New Orleans. Okay, so keep those things in mind. And I noticed there are a lot of people that who traveled to New York or other countries who are in 14-day quarantine. Okay, as I just rubbed my eye. So remember, flatten that curve. We have to flatten that curve and bring that curve down. By the way, it's a bell curve. Those of you that are in math, and I taught math, that's why I like to look at these numbers and talk about these numbers. But we're trying to flatten that bell curve so that when it goes to the apex of the curve, it doesn't overwhelm our healthcare workers. And I have some friends in Farmington that are asking people, craft people to make those masks because there's a short supply of them in our area. So shout out to my friend that put that out on Facebook. Okay, so some other things that are important that we look towards. I think last I heard, I saw two things yesterday. One, I think about 4 or 5 o'clock, the press said that there were 39 cases in the Navajo Nation. However, like maybe an hour or two later, President Nez put another press release out saying that it had jumped to 49. Okay, so 49, 39 to 49. Again, these numbers are increasing. So remember, people, stay home, be safe, take care of yourself. My wife just heard this morning on the news that they were telling people, make sure you wipe your mail, wipe your credit card off, just to prevent it. This is all prevention. This is all precaution. And I think one thing that's important is a lot of times we try to take care of things at the end while we're sick or after we're sick. Now, keep in mind, these are just precautions that we're taking. People said that my wife and I are you're fearful. It's funny too, because my mom said that to me. She, you're just fearing, you're believing this media hype, and I'm like, no, it's not. It's just prevention, okay? Like my wife and I take care of our health. My Che was had diabetes. So as a precaution, my wife and I, we run daily to take care of our health. No one says, "Oh yeah, you're just buying into the hype of obesity," right? But that's not it. It's just that's my way of preventing that from happening to me. Similarly, this taking care of our house and wiping things down and wiping the mail. Like I said, I bring our mail in with a glove. You may think it's over the top or overreacting, because these are the things I've heard. Oh, you're overreacting. That's fine. People can only take care of themselves. They can only do what they can for themselves. But you do what you have to for you. I mean, I guess there's varying levels for this to happen, but in order to prevent it from getting out of hand, we got to take these measures, social distancing, and just keeping up with that. And so anyway, if you all have any questions, leave the comments. I did open the comments up on my video. Whenever I post these videos, I put that it's okay for kids. When I put that it's okay for kids, it locks up any comments. So I did open those comments up for people to comment below. And again, these videos get more exposure on YouTube whenever people like it and whenever they make comments on it. If you don't agree with this, that's fine. I know someone was criticizing my videos the other day, and he goes, "Who are you to say this?" Well, whenever you build a platform of people that have listened to your podcast for 3 years. I'm going on 3 years that my podcast has been up and running. I've taken a lot of this research and couple that with the education. Not that education is everything, okay, but just the education that I've attained and the research that I've done. And people coming to me and say, "Can you put a video out there?" I know people listen to you, and that's why I did it. And in the comment in the post, I told the guy, I was like, you know what? You don't have to listen to it. You can just scroll by it, and go to the next thing. And that it's a choice. Everyone has a choice to watch Fox News. Everybody has a choice to watch CNN. Everyone has a choice to watch MSNBC. This is just my way of helping the community, and I do appreciate the number of people that have watched the videos, and the people that are taking this serious too, because it takes us individually to put these precautions into practice. Okay, people. All right, appreciate it. Shike agi, and my friends and relatives out there. Thank you all for watching this, and I'll try to do another one either tomorrow or the next day, maybe every 2 days. Okay, thank you. Go on, have a good day.